Hi, I'm Dr. Brad Dibble, a cardiologist at Pace Cardiology in Barrie, and today I want to talk to you about some heart-healthy tips you can do that don't require any fancy testing and may not even require you going to see your family physician before you decide to implement these. The number one I want to talk to you about is diet. The Canada Food Guide just came out with its latest version from 2019, and it has a lot of very healthy tips about how to eat healthy so that you can reduce your cardiovascular risk in the future. Part of that, of course, is eating in the right amounts to try to achieve a healthy weight. And that brings me to the second suggestion. A healthy weight is best achieved through a combination of healthy eating and regular exercise. Those two combined work very well together to try to prevent you from having future cardiac events. In fact, one study showed that if you have healthy diet, healthy exercise, and you manage to get to a healthy weight, and you avoid smoking, you can reduce your cardiovascular risk by up to 80%. So smoking is another important one. If you're a smoker, you should make every effort to quit. If you're exposed to secondhand smoke, even if you're not the smoker, that also increases your risk, and it's best to avoid that if you can. One of the others that is important to think about as well is having a good amount of sleep. Too many of us don't get a proper sleep through the evening, and it's important to try to aim for 7 to 8 hours. That helps regenerate your body and gives you a lot more energy for the next day. And the last tip I want to talk to you about is stress. We all have stress. We can't avoid it completely, but it does contribute to some risk to our heart health in the future. So if you can reduce stress and learn how to cope with it better, that helps. Some stress can be eliminated. If you're in a bad job that you don't like, you may be able to change that. But some stress you can't change. Things like if you have an unexpected car payment, or if there's another health crisis in your family that you have to contend with. So the best you can do is learn how to cope with those. Now, your doctors can help with things like sometimes they can give you counseling about stress. Sometimes they can give you dietary advice or send you to a dietitian. Sometimes they can give you some prescriptions for exercise and activity levels because they might do a stress test first. So you can certainly explore these with your doctor, but you realize these are all things you can implement yourselves without having to go to a specialist or have any special testing. So remember, healthy diet in the right amounts, physical activity, avoiding smoking, getting to a healthy weight, getting proper sleep, and reducing stress, and you can really cut back your cardiovascular risk.